Hello, you guys. Here is our NCLEX style practice question for today, presented by Apex Nursing Academy. A gastrectomy is performed on a client with gastric cancer. In the immediate post-operative period, the nurse notes bloody drainage from the nasogastric tube. The nurse would take which most appropriate action? Now, anybody that knows Apex Nursing Academy knows the number one test taking strategy is to repeat the question. Repeat the question before you drop down to answer choices. Give yourself a chance to recognize the significant data and then go right into analyzing the significant data. So I've highlighted significant data from this question. We're talking about a gastrectomy. This client has gastric cancer. We're in the immediate post-operative period. There's bloody drainage from the NG tube, and they're asking for the most appropriate action. So you have your cues, you got your significant data, you want to go right into analyzing cues. You're doing all of this before you're picking the answer, right? Go right into analyzing your cues, okay? So what do we know? Bring all your nursing knowledge to the forefront about the significant data. Whatever is in the question, that's what you bring to the forefront from your nursing knowledge, okay? So we're talking about a gastrectomy. This person has gastric cancer. Remember, break down your words if you can't remember exactly what they're talking about. We're talking about something with the stomach and ectomy, surgical removal. So they've had a surgery to remove the stomach. We're in the immediate post-op period. That's significant data because they're giving us a time frame of when we're taking care of this client. Remember, in the post-op period, we're all about preventing complications. What do we know about bloody drainage from the NG tube? Bloody drainage from the NG tube. In this context, immediately following a gastrectomy in the post-op period, they may have some bleeding. So we keep that in mind. We want to remember about placement and safety issues with our NG tube, and we have all of that knowledge in the forefront as we go over the answer choices, right? Remember, you want to also be thinking about, they're asking about the most appropriate action. So think about patient safety, preventing harm. Is the action appropriate or not? And then prioritize your actions. You may have more than one correct action, but you want to take the most appropriate action. So let's think about our answer choices. Now we're ready to pick the best answer. A was measure abdominal girth. Well, why would we measure abdominal girth? Measuring abdominal girth, it gives us some information about, gives us an assessment about abdominal distension. But why would we be doing this for a NG tube client post-op gastrectomy? So maybe that's not our most appropriate action. Let's keep going. Irrigate the NG tube. Irrigate the NG tube. Well, it's telling us that the NG tube has some bloody drainage. So that's telling us that the NG tube is draining. Normally, when we irrigate the NG tube, it's because of some kind of clogging. It's not draining properly. We have an order that says to irrigate the NG tube. We don't have any of that. No indications of that in our scenario. So we're just going to eliminate that entirely. Continue to monitor the drainage. Well, we've already established that bloody drainage is expected in this situation. So that is a reasonable option. We'll just go ahead and look at the next option. Notify the surgeon. Well, are we going to notify the surgeon immediately because of bloody drainage? There's no need at this point because bloody drainage is expected in the post-op period. They've had a gastrectomy. We're right after surgery. that's expected in the first 24 hours. You may see some bloody drainage, and then it'll turn to brown, may turn to yellow, may turn to clear. That's just the stages of the drainage. So right now in the post-op period, bloody drainage is okay. We don't really need to notify the surgeon for that. We eliminated B, right? We eliminated irrigating the NG2. We don't need to do that. It's not an appropriate action. Measure abdominal girth is not an appropriate action. That leaves us with C. Continue to monitor the drainage. Remember, you want to think like a nurse when you're answering these questions. You want to trust your nursing knowledge. This is when your patho and all that good nursing content comes into play. You've learned this stuff for a reason. Bring it all to the forefront and use that knowledge to answer your questions. Use your cognitive skills, recognizing cues, analyzing cues, and then you will be able to pick the correct answer. Remember to use your cognitive skills when you are answering these type of questions. So that's it for today. Until next time, bye bye.